emergency order extending our Hunker Down Hoosiers or our stay-at-home policy and order for another 2 weeks. I think you'll better understand why we came to that conclusion here in just a few moments. And lastly, just a word of thanks. The President of the United States, President Trump, has just approved my request to declare a major disaster declaration for all of our 92 counties here in the state of Indiana. You'll hear a little bit more about that as well. So at this time, I'll turn it over to Dr. Chris Box, if you could give us an update on the curve and other items as well.
Thank you, Governor. I know that hearing bad news every day is really hard, and I hate starting my part of this broadcast every day with it, but it's imperative that Hoosiers understand the gravity which we're facing right now with COVID-19 across our state. Today, we unfortunately reached a milestone and surpassed 100 deaths from COVID-19 in our state. As we reported this number this morning, 24 Hoosiers have died from COVID-19. That is the highest number of deaths reported to date in a 24-hour period and reflects individuals who died between March 29th to April 2nd. This sadly brings the total number of lives lost in Indiana to this pandemic to 102. I had my team calculate what is truly a very crude mortality rate, which at the time is basically 2.9%, with the best data that we have available. What I want to make sure that you understand is that in Indiana, we have really done targeted testing only for our highest risk population, oftentimes really those individuals that were hospitalized. Those 80% of individuals that were sick, we just asked you to stay home and we didn't test. So consequently, this number is going to be much higher than the real mortality rate. We continue here. Than in others. It's important to remember that we continue to do targeted testing of those individuals who are at higher risk. I know this is a time when we're traditionally thinking about spring break, Easter, but I want Hoosiers to continue to take social distancing seriously. These are not normal times, and we cannot act as if they are. I know it's hard to think about missing a family gathering, but the best thing we can do to protect our loved ones is to follow the guidelines and flatten this curve as quickly as possible. The best way to keep from overwhelming our hospitals and our healthcare system is to keep people healthy. And we're still planning for when our healthcare system will experience the peak of that surge of COVID-19 patients. As we prepare for the peak of that surge, the National Guard is a critical partner in that planning. Thank you.
Thank you, Dr. Box, and that's a perfect segue to Adjutant General Dale Lyles, who will give us an update, a briefing on some of the ramped up activity that you'll see over the weekend as we head into this surge.
Thank you, Governor. I'm Brigadier General Dale Lyles, the Adjutant General for the Indiana National Guard. The Indiana National Guard continues to be actively engaged in the COVID-19 response. We are supporting Governor Holcomb's strategy to mitigate the COVID-19 virus. We are in support of the Indiana State Department of Health as we collectively work to flatten the curve and safeguard our fellow Hoosiers. Guardsmen are supporting communities all across the state, and our efforts include packing lunches and preparing meals at local food banks to be handed out in drive-through distributions, sorting medical supplies and PPE to be distributed throughout the state to those hospitals with the most urgent needs, augmenting staff and assisting in planning operations, supporting the State Emergency Operations Center, and utilizing our skills of future modeling and predictive analytics to advise the Governor's executive planning team. We are also supporting the Governor's surge planning efforts. We have established a site survey team led by Colonel Steve Hines, a seasoned combat engineer and current commander of the Indiana National Guard's 219th Engineer Brigade Combat Team. Tomorrow, Steve and his team will link up with members of the U.S. Army Corps of Engineers and Indiana State Department of Health and begin to conduct surveys and assessments of potential sites that could function as
$20 a day. 2 agencies in Southwest Indiana have reported somewhere around a 50% increase in crisis calls. 211, which normally gets about 1,000 to 1,100 calls on a big day, has been getting up to 25,000 calls a day, many related to mental health and suicidal ideations. So while the bulk of our focus has rightly been on the heroic public health and healthcare efforts to combat this pandemic, there are 3 areas we would like to highlight that will be affected both during the current crisis and our recovery from it. And yes, there will be a recovery. First, we know that people that suffer from serious mental illness and children who suffer from serious and severe emotional disturbances are at higher risk of mental health crises. We've been working closely to provide maximum flexibility, including using telehealth, to our treatment providers to ensure that crucial services for this population can continue. They've responded with amazing creativity and innovation. The ability to access mental health services without barriers like transportation or standard office hours while still being able to maintain social distancing has been one of the highlights of this response thus far. We've learned that this type of access should be available to Hoosiers, public health crisis or not. Second, we know that many Hoosiers, even those that do not have a history of mental health diagnoses, are currently suffering from an increase in adverse mental health symptoms, caused not only by the social distancing that has disrupted so much of our daily lives, but also the uncertainty of the time to come. Normally, to the extent that anything in a disaster can be normal, in a disaster, the survivors suffer a terrible loss and then work to This slowly unfolding, constantly changing, life and livelihood disrupting crisis is unlike anything we have ever seen, and is going to cause many people to experience increased anxiety and depression. Our message to Hoosiers going through this is twofold. One, it's normal to feel this way. And two, help, and help that works, is available. If you find yourself experiencing these symptoms, please seek help. You can call 211. You can contact your insurance company to find access to teletherapy, and you can talk to your doctor about whether medication might be right for you during this time. Finally, and not at all without our notice, for those with substance use disorder, this can be an especially scary time. They say that the opposite of addiction is not sobriety, but connection. And it's very easy to be disconnected right now. However, we've been blown away by the resiliency and response of the treatment and recovery communities, and we've been honored to support them during this time. 12-Step and other groups have gone virtual. Residential substance use disorder providers and recovery residences have kept their doors open. Thanks to the quick work at the Division of Mental Health and Addiction and remarkable flexibility from our federal partners, access to life-saving medication-assisted treatment has been preserved in Indiana. I'd like to introduce you to one of Indiana's many experts in mental health, Dr. Ahmed from the Bowen Center. He would like to offer the Dr. Ahmed.
Thank you, Governor Holcomb, Secretary Solomon, and Jay Chaudhary from Division of Mental Health and Addiction for allowing us to continue effective patient care via teleservices. My name is Dr. Ahmad, and I'm so happy that you have reached out to talk about the stress and anxiety that are feeling pretty overwhelming for you right now. First, I want to say that many people are experiencing significant increased anxiety and depression recently. This is a very normal response to being in such an uncertain time. Even people who are generally calm will feel worried when they're surrounded by so much uncertainty. For those of us who are already prone to anxiety, news of a disease outbreak can significantly increase the symptoms that we are already working to learn to manage. We might begin to worry whether we will be infected, whether our friends and families are safe, and how we will handle it if we ourselves or someone we love become ill. While some worries is absolutely normal in these circumstances, for some, the spike in anxiety may start to become so much overwhelming that it's become difficult to function. That's when it is important to help. First, let me ask you a few questions to see how these things are affecting your life. Are you spending most of your time feeling worried? Are you feeling you can't seem to control your worry, even though you are trying? Are you having panic-like symptoms, shortness of breath, chest pain, muscle tightness? Are you avoiding talking to your friends and family due to your worries? Are you having trouble falling and staying asleep due to these constant worries in your head? Are you feeling emotionally out of control or burnout? Have your family and friends started mentioning that they think your worries is getting out of control? Since you have said yes to several of these questions, it appears that seeking some help for your stress might help you feel better. The good news is there's a lot of options out there to help you. Some people feel a lot better when they're able to find a support group to manage their stress and anxiety. These could be online or organized via telehealth through a faith group or counseling center. Some people like to read self-help books to learn some technique that might help control their worries. Others find counseling with someone like me to be incredibly helpful. Therapists are highly trained to help people learn how to sort through their thoughts and organize them in a way they feel less overwhelming. Another option would be able to talk to a primary care doctor to see if non-addictive medication might help you feel less overwhelmed so that you can do things you need to do on a daily basis. You have to choose them available through phone or internet, so you don't even have to leave your house. Community Mental Health Center have many options for care. At the Bowen Center, where I work, I've been able to provide care via telephone. I can also prescribe medication and have it delivered directly to your door. Here are some things you can do at home that might be helpful. Make a list of things weighing on your mind. Circle the things you can control. And then list the top 3 things you can do to help move toward. When you find yourself focusing on the worst possible outcome, force yourself to write down the best possible outcome as well. Tell yourself both are possible, and that the reality is probably somewhere in the middle. Step away from your to-do list, if even for a moment, and know that being task-oriented has its place, but does not always have to take priority. Find an alternative, watching a television show, taking a walk, taking a shower, reading, calling a loved one, anything you can do to take your mind off the worries for a few minutes. If you're worried about basic needs for you and your family, call 211 to see what resources might exist to help. The future feels a lot. Give yourself a treat. This can be anything that you love, a dessert, a moment of quiet without your family present, permission to go to bed early, wake up early. Practice setting boundaries. Say no to helping others if you are struggling to stay afloat yourself. Move your body. Try at-home workout with tons of free online options out there. Zumba, yoga, plyometric exercise are great to try at home. Thank you for reaching out to us. We are here to help you, support you, and to provide resources that will get you through this difficult time. Thank you so much.
Thank you, Dr. Ahmad. I made some notes for myself, and that all rings very true to, I think, everyone sitting at this table. Really appreciate you being part of today's delivery. Also, I just want to say before we get to taking some questions, today, just hearing this has been exactly why we are taking all the steps that we're taking, additional steps that we're taking, to all in an effort to help slow the spread, obviously, of COVID-19. Dr. Box, as you heard, just reported our highest fatality over a 24-hour period from one day to the next. 24 families are still grieving. That's in addition to the 78 that still are as well that have passed before them. And these numbers, I think it's fair to say, it's a signal that we are at the start of this surge, but just the start of this surge. When you look at those charts and you look at the slope. So again, want to underscore just how incredibly important it is that we each, as Dr. Ahmad, as Dr. Sullivan, as Dr. Box have all said, that we're each taking care of one another, that we're each taking care of those who we love and those who we've never met to the best extent of our abilities. Because as we said just a couple days ago, we are all in this together. You and me, Jen, Chris, Dale, all of us are in this together, and we're going to do this. And there is going to be reconstruction, and there is going to be recovery, and we're going to do it together. That starts with maybe things that seem small at the time, like washing your hands religiously. You've got me there. Quit counting. It starts with not just, just listening to this conversation, not just social distancing. We're still socially connected. We're physically distancing ourselves from one another. But we have to stay socially connected, but physically apart. And that's why when I hear stories about people going out every day and singing God Bless America around the flagpole, or if I hear, church bells being rung at 10 a.m. Evansville Police Department. And the name of the song, there's a lot of songs out there that have a new meaning to them as we go through this. You hear a different message, maybe one that wasn't intended initially. But this song that the Evansville Police, the skit that they're doing is a song called Don't Stand So Close to Me by, you guessed it, the Police of Sting fame. And so these are some ways that we're getting through this together, lifting each other's spirits up. And the more we do this together, again, the faster and safer we will get through this, all of us. So thank you. And we're happy to, Rachel, open up the lines and take some questions.
We begin with Cameron Riddle, RTV6.
Sure. Hello, Cameron.
Hello, Governor. Good afternoon. The therapy that we just got was amazing. We enjoyed that here at the House. So thank you for doing that. I know a lot of people needed that. Couple of questions for Dr. Box. Can you explain when it comes to that total testing number, that the number of people tested does not equal people who tested negative? That could mean that you've either tested those people and they were just not positive that day, or you just haven't got the results. Because a lot of people are looking at the numbers and saying, oh, 16,000 were tested, but 3,000 are positive. That means 13,000 people don't have it, and that's not correct. And then earlier this week, I asked you a question about masks, and you gave a great answer saying the public doesn't need to wear masks because it's not practical. But that conversation continues to pop up more and more across the country. So how can we balance you saying that's not practical with these guys now saying, well, it's effective?
So very good question, and I watched the national news too and heard that they're leaning toward suggesting that everyone that goes out have a mask of some kind on. And I'm certainly not going to object to that. What I would ask is that you do not wear the N95 and surgical masks that our first responders and our healthcare personnel need so desperately. The second thing with regards to the data, we have been working very hard to make sure as every new lab comes on, as every new feed comes in from that's testing for us or an old lab that's doing a new test, that we get all of that fed into our data. So that's the problem, is that it just takes some time to get all that established.
Thank you, Cameron.
Rob Burgess, the Wabash Plain Dealer.
Hello, Rob.
Hey, Governor, how are you today?
Fantastic. How are you?
Great. So good to be with you again. Dr. Box, returning to the masks, yesterday the governor mentioned local teachers and administrators here in Wabash at the Heartland Career Center who were constructing masks. We also have a Facebook group here in Wabash that's dedicated to constructing their own masks after our local hospital put out a call for them. My question is, how effective are homemade masks? Is it possible many common fabrics that people might make to use these masks with are too porous to keep viruses out? And are there guidelines that you can offer the public who would like to construct their own masks at home?
Mm-hmm. That's an excellent question. You know, cloth masks tend to hold moisture better than other masks. So we oftentimes in medical personnel, we're looking for that moisture wicking barrier that prevents that, from settling into our mask. And the colorful cloth masks there, and then wash them.
Thank you, Rob.
Rich Nye, WTHR.
Hello, Rich.
Hi, Dr. Box, if you could just clarify a little bit where we're at in terms of positive test percentage and what that number tells us in regards to if we're only testing people who have symptoms or are on the front lines, is that percentage going to be naturally higher? What does that percentage tell us, if anything?
Well, I think what it tells us, we talk about targeted testing, that our healthcare providers are doing just that. They are testing our higher risk population, those individuals that are sick and those individuals that oftentimes are in the hospital. And so when we look at our targeted testing percentages, it's been traditionally anywhere from 13 to 15%. I think today's was actually up to like 17.8%. If you look at some of the around the United States, individual places that have had a large amount because they're a hot spot of testing and they do just average drive-through testing, that percentage is normally about 3 to 4%.
Jeff Smith, WLFI.
Hello, Jeff.
Hey, hello, Governor. Thanks again. Good to speak with you. Hey, well, I wanted to ask you about the legal basis, the constitutional basis for you issuing executive orders. We're hearing some people who claim that that's actually an unconstitutional action on you.
To the contrary, I mean, we're happy to address any constitutional question specifically that they would have. And we've vetted this. Obviously, I'm not the only governor that's done this around the country, taken these actions, but they're all perfectly constitutional and the right actions to take, quite frankly.
Nikki Kelly, Fort Wayne Journal-Gazette.
Hi, Governor.
Hello, Nikki.
I was wondering if you could talk to me, or if Fred Payne is there. Several states are already sending out the $600 supplemental benefit for unemployment, but I understand Indiana's going to wait until May and was trying to figure out why.
Yeah, Fred's stepping up, Nikki.
Hi, Nikki. Good question. We've been issued specific guidance from the U.S. Department of Labor on how to handle those types of payments. And when I mentioned yesterday that we're looking toward May being the first part of the year, the first payments being made, that's straight from our direct communication with the U.S. Department of Labor and really talking to them and working through them with their guidelines.
Elizabeth, PBS Michiana.
Hello, Elizabeth.
Hello, Governor. I wanted to ask you about your announcement that the President has approved the disaster designation for all Indiana counties. What does that mean for us in real terms?
Steve Cox is stepping up to the mic. He's with Homeland Security.
So my name's Steve Cox. I'm the Executive Director of the Indiana Department of Homeland Security. So on Monday, the Governor requested of the President to make the disaster declaration for all 92 counties. And basically what that amounts to is Indiana receiving public assistance money to the tune of about 75% of costs incurred by the governmental entities within Indiana in response to the COVID-19 crisis. We had requested individual, and the individual assistance piece is still under review. So there are still some outstanding pieces to that. So,
thank you, Steve. General, you want to talk about the Guard percentage?
So that declaration enables the Army National Guard and the Air National Guard to receive 100% reimbursement for the missions